Thank you.
Thanks there. So can you see my presentation first slide?
Yeah.
Oh, fabulous. So thank you very much for inviting me to speak, and for the very kind words of Jenny, heralding lots of stuff about wobble rooms. So hopefully people are a bit warmed up. So I'm a consultant paediatric ophthalmologist from Bradford Teaching Hospitals, and I'm going to share with you a little bit about the impact of creating safe spaces for wobble rooms, both during COVID and, as we've heard, beyond. So I'll just start with how it all began. Last March, as part of the COVID planning scheme for our hospital in Bradford, was attending meetings and hearing what was going to happen, the worst case scenarios, the war games that people were planning for how we would manage. And I began to feel a bit overwhelmed by what it was that was coming. And yes, I'm an ophthalmologist, but I could see how this was going to have an impact on the eye care we could provide to people, let alone everything else. I knew that the staff were going to feel the same. And it came from a place where I realised I couldn't make it better for them. I couldn't tell them it was all going to be okay. I couldn't reassure them that they weren't going to be redeployed to the wards, because they were, that we weren't going to be asked to stop giving care, because we were. But I could listen, and listening to people sharing their worst thoughts is really very, very powerful. So having driven home from work 5 days in a row and had a little cry each day, I thought other people are going to feel like this, and they're going to need a space to share this. They're going to need a space where they can tell somebody, this is how I'm feeling. I'm going to say it out loud. I can have a little cry or a shout or a scream, or just sit quietly. And so I said to the nurses at their morning huddle, look, my room today is the wobble room. So if you need a little wobble, come and knock on my clinic room door. Just sit and tell me what it is you need to tell me. And they totally ran with it. And within 2 days, I found a little sign stuck up on the nurses, the huddle board, where we share who's in what room each day for clinic. And they'd assigned a room that they themselves were going to use as a wobble room. And one of the senior sisters would make themselves available to sit in there, to just listen, to let people share what they were most worried about. This then took off somewhat via Twitter, and hugely with the help of the Fab Academy, and was the most retweeted thing I've ever done, thousands and thousands of times, and it's been popping up on Facebook and being shared on Facebook, and it really seemed to capture the mood of how many people were feeling at the time. It took off so much that nationally people began to catch on to it. So there were pieces on Virgin Radio Breakfast Show, on BBC 5 Live. It was on the BBC News Channel, local press, Manchester Evening News, The Sun, the Nursing Times, even spread as far as Vancouver. And this little map shows all the wobble rooms that I had found in June, but that is not all of the wobble rooms that existed. They were really very widespread in hospitals, in community settings, in GP settings, in universities, all sorts of places. So let's just go back a little bit for people who don't know. What is a wobble room? Well, it's a space, a sanctuary. It's a place where you can acknowledge the normal reactions that you are having to what is a very abnormal situation. Is what was happening in March and April, and actually in Bradford, is happening right now. We have the same number of patients that we had at the peak in April. This is not a normal situation, and so it's completely normal for you to feel overwhelmed, upset. We found that you could share your worries and get rid of the stuff that you didn't like, but actually sometimes we just needed a giggle. Something funny had happened, and we just needed somewhere where it was appropriate to go and have a giggle, because on the shop floor was not the right place to be doing it. They developed into somewhere where people could reflect on the positive, the teamwork, the compassion, the generosity of the general public. They became the treat room in many places. It's where all the booty was, where you went and found all the sweets and stuff. And we'll show you some pictures of how different people interpreted it in a moment. So David Grant was somebody who picked up early, and I really love the icon that he used for this jellyfish, and said that so many changes are being introduced, but they're not all negative. Some we have talked about for years, but without the focus that comes with urgency. And that was it, as we've all known for a long time, that in the NHS, staff communal areas have been stripped out one after another to make space for very important clinical space. But actually, we need those spaces. We needed them back. So I'm going to try and do some staff reflections based on something that Terry's put together for me, which is very kind of her. So let's see if this works. So can you now see a screen that says wobble room for today is? I assume that's a yes. Let's see if this plays.
Hi, Rachel, can you hear me?
Yeah.
We're just viewing your, I think your desktop, and it's got staff reflections, click to add text.
Okay, so what I'll do then, I'll just come out of this and I'll stop sharing and then reshare with a different screen.
Fantastic, thank you.
No, thank you. That's what I thought I'd ask. Let's just, oh, I've got too much chat on here now. Right, here we go. I've got my share screen button again.
If anybody does have any comments or questions while Rachel's just sorting that out, please do share them in the chat and I can ask her at the end.
Sorry, I had it loaded up and it's just disappeared. Right, we're just getting it loaded up again. Thank you for bearing with me, everyone. I did. Okay, right. Let's have a go at sharing screen again. We might try this and see if this works. Got something now?
Yes, we can see
Okay,
wobble room for today's room 8.
Well, okay, so I'm going to press play again. It's just not playing for me. Okay, let's try that.
Bags that were made for us for washing our uniform in. All of these things brought together gave a positive. The room was bright, it was welcoming, and put together with love to share
So let's see if I can get my screen back up again on current slides. So have you got something that says, why do we need wobble rooms?
Yeah, we've got that.
Brilliant, excellent. So those, very grateful to Terry Porritt, who helped amalgamate those staff reflections from around the country. So why do we need wobble rooms? It fits in with the Kubler-Ross model that you may be familiar with, to do with grief, in that how the human psyche responds. So you start with shock. And I think when COVID was being talked about at the end of last year in January, we were a bit surprised and shocked about it. And then there really was denial and disbelief that this won't happen here. This can't happen in the NHS. We saw what was happening in Italy, and those dreadful pictures of people on camp beds outside in tents going, no, it can't, it won't. And then the frustration that actually this was coming, and that we were going to have to stop providing the high quality care for our subspecialty patients because we were going to divert all resources into COVID. And that brought some upset and some frustration, and definitely some anger. It's not fair. It's not fair that we have to disregard one set of patients for another. It's not fair that I can't see my family. It's not fair I can't go on holiday like I was expecting. And that's the point at which many people need wobble rooms. They needed to be able to express that out loud. Then we hit the bump, the bottom of the bump, the depression and the low mood and lacking energy, and that really, this is hard, really hard work. But the other place that we need wobble rooms is for people on the other side of that dip, the people who were coming out of that low bit and needed something to put their energy in, needed something experimental, needed to engage in a different way, to catch the people who were on the way down and go, look, here's a wobble room. This is something positive I can do for my staff. Certainly our senior sisters felt there was nothing else they could do for staff. They were delivering terrible, terrible news to them every single day. But here is an opportunity they could show compassion. They could say, I know this is rubbish. Come and let me help you. So it's picking people up on the other side that was a really, really important part of wobble rooms. It was a ray of light in the middle of everything that felt so awful. So what is a wobble room? Well, it's what's called a third space. So traditionally, third spaces are places that are not home and are not work. They are somewhere else. So it's the Starbucks phenomenon, where people work somewhere that isn't an office and isn't their home. But in a hospital, the third space is somewhere that isn't clinical and isn't admin. It is the Costa Coffee. It is the canteen. It is the staff room. It's somewhere you can unwind and let your guard down. Crucially, it's about developing and deepening friendships, where we can develop this community of cohesion and a sense of identity. And that's really what came from wobble rooms, is people, we're all in this together. It promotes conversation, relaxation, and sparks creativity and fresh thinking. We're recharged and inspired. And that is what was absolutely needed during the first peak and will be needed in the second peak. So there is some definite real theory behind what a wobble room is for. Early on in the evolution of wobble rooms, I teamed up with a lady called Tilla Brook, who's a coach, and Vanessa Randall, who does these amazing, she produced these overnight for me, little resources, coaching resources, to try and do a bit of on the spot coaching to yourself if there was no one around. So helping people understand that they were carrying their emotions around, they were squeezing them inside, they were like a dark cloud, and that they could not minimize it or say it doesn't matter, but actually you could let go of bits of it, that the emotion will pass through if you let it pass through. And that we needed to look for the good, or we needed to find it and grab it and share it, because there was so much good going on that was going to get lost in and amongst all the dreadful stuff that we were all experiencing at home as well as at work. I know lots of people felt it was worse at home, is that the families were saying, don't go to work, please don't go to work. And they were finding that really very challenging. And that these are tough times and it's okay to feel what you feel. But those emotions will be different on a day-to-day basis and will be very different for different people. But acknowledging what that is that you are feeling and write it down and either carry it with you or screw that up and put it in the bin. If you wanted to get rid of that, that was a way you could do it with these resources. And they are free via the blog, and I'll put the blog up in a moment. So here are a couple of little screenshots of some wobble rooms that popped up on Twitter. People using the wobble room resources, people using it for challenges, beautiful sofas and fairy lights, and places to have their coffee, or somewhere just to sit quiet, socially distanced, of course. But the medical school and the University of Glasgow really went for it and had a little visitors book for people to write down how they were feeling. And I promise this wasn't put in before. United Lincolnshire Hospital's wobble room, I love the colours that they used for theirs. And Hamilton had a wobble dog, which is very exciting, with a bit of pet therapy that used to visit once a week, just as a way of the staff discharging how they were feeling inside. Colouring resources were really popular. So I've got another video here of the staff from Bradford hospitals sharing their experiences, particularly the radiology department, who really absolutely went for it and were hugely instrumental in promoting it for us locally. So I hope you will have a YouTube screen coming up, and we'll just listen to this for a few minutes.
having electronics to take that up.
Okay, so
hi Rachel, sorry to interrupt.
it's okay.
We were having trouble hearing the YouTube link, so
Okay.
I was just wondering if you could just quickly summarise what, because we saw all the pictures.
Yeah.
You could summarise what we saw,
No,
and then
that's fine.
we could share
I will do.
after.
Super. So it'll come out in these slides here, but thank you. So there was staff were saying what an impact it had had, and why is it that wobble rooms have had an impact? Well, it's a space to go which is immediate and accessible. So it's in your area. You don't have to go to a different building. You don't have to go and ask permission. You don't have to book it. It's just there. And it gives people permission to show compassion for each other. We show compassion for patients all the time, but we have to show compassion for ourselves, and letting it being okay for people to go, I'm not having a very good day, and being able to immediately acknowledge that. There was no permission required. So you can acknowledge this emotion, and certainly one of the things that was mentioned in the videos, we had psychology support. So there would be 2 hours a week where a psychologist would be in the wobble room, so you could, without needing to book an appointment, sit and unpick how you were feeling and process that in a different way. There was no rota. You just, when you needed to go, you did. We've talked about the third space, and the photos here in the slide are of the exit wall that the radiologists were very proud of. This is where we are going. Okay, in the future we will be back to having parties, we will be back to having social events and being able to hug each other. And they felt, for them, that was so important to say, look, it's not always going to feel like this. One member of staff said that sitting in the wobble room might be the only time the whole week that you are on your own. Is that you're surrounded by patients and staff at work, you're surrounded by your family at home. Actually, you just needed some time just to be on your own. To have a non-clinical space, to have a few minutes before, without leaving the department. You couldn't go to other places because we couldn't move around the hospital. Well, this is where you could escape to, and seeing something nice before you went back onto the shop floor. It made it easy to acknowledge your feelings, embracing wobbling as a positive thing, a safe space to say it out loud, and normalised asking for help, made it normal to say, I am struggling today. We acknowledge that wobble is not the word that everyone likes, and there's some people who feel very angry about the use of the word wobble, saying it's belittling some really quite difficult feelings that people have. People can call the room whatever they would like to call it. Wobble worked for lots of people and got the movement going. So I'm unapologetic for that, because if we'd called it something else, it wouldn't have taken off. But I understand that going forward, people would like to use different terms, call it something else, or maybe more than just a wobble that they're having, and that's fine as well. But most of you who will have worked in staff wellbeing know that some people usually minimise the feelings that they are, and actually calling it a wobble might be that gateway to being able to acknowledge that you feel a lot more than a wobble. Staff have felt valued and recognised and important, and photos and pictures done by local schools and by people's children, it's a place to put those up. So if you don't yet have a wobble room, or you want to try and help other people within your hospital have one, how do you get started? Well, quite simply, all I did was write wobble room on a piece of paper, stuck it to a door and told people about it. That's it. It didn't need more than that. And as we're saying on the radiology video, it evolved. Is that they just found a room, and then gradually, week on week, it changed. What people want, and it changed. It's important to listen without judgment and with compassion. This isn't a wobble competition. It's not who has had the worst week this week. a barrier to people sharing how they feel is they think, oh, but someone else has got this so much worse than I, so I won't say mine because it's nothing compared to this person's problem. But actually the wobble room is to say it doesn't matter how big or small your wobble is, you can say how you feel. People own what they create, so every area has made it their own, and no rules is the only rule. So some people have been put very strict rules, you can't talk about COVID in this zone, or you can't eat in the wobble room, or actually there'll be local rules that you need to make in terms of safety and PPE and distancing, but actually let it evolve. So I spoke about the blog that we've done that's on the 15S30M website. That's another social movement that we started to do with quality improvement and joy in work. So go and have a look on there. But if you go to the blog section of 15S30M, it's probably on the second page now, you'll find the Where's Your Wobble Room blog. And again, there's a similar version of it on the Fab Academy website. So what is the future of wobble rooms? Well, we're delighted that wobble rooms were included in the NHS People Plan as a key feature of health and well-being of people. That for me really validates how important they have become to people, as having that space within a department, for every department, where staff can express how they feel to each other rather than needing to have a formal process for that. I spoke earlier about a community of coping, and I'm delighted that the University of Nottingham and I are putting in an application for a PhD for someone to come and study the impact that wobble rooms have on this emotional labour, that individual experience of what we call customer interaction. Well, for us, that's with patients and relatives. Huge anger and frustration that patients and relatives feel causes real pain to us, particularly when we know that this is not how we would want to do this, but COVID is making us provide a service in a way that we wouldn't normally want to. We're not able to have relatives to visit patients. We turn to each other to cope with this, but we need an off-stage area to do it. Developing this workforce culture is so important, and it's an opportunity to influence and offer positive strategies, and lots of amazing positive things have come out of wobble rooms across the country. So South Tees said goodbye to their wobble room, which was very sad to hear in July, but actually what it's given way to is improved restrooms. It became a real it showed evidence for how important it was to have restrooms in hospitals, and they used the wobble room as a real lever to make that happen, and that's hugely positive. And the light box, and there's all sorts of things in the in Barnsley Hospital's wobble room, which is huge and beautiful and wonderful. Again, it's a place for community donations to go, where the community felt they were making a difference. So this is my final slide, just with lots of pictures of the various wobble rooms. I'm sorry if your wobble room isn't on there. I did my best to amalgamate as many as I could, but really to say the wobble rooms are yours to make what it is that you will from them. And I'm happy to answer any questions you might have, or hear you chat about what your experience of a wobble room. Thank you.
Lovely, thank you so much, Rachel. We've had a few comments. Bernice said wobble, when you were talking about the word wobble for your room, it said works for me, it's direct and also almost gives permission to let go. She also said we actually have our employer support staff offer slots where anyone could come in and be able to be supported with their thoughts alongside the central wobble room. So it's been really well used.
That's great to hear, and actually that's one of the things I think has been an unintended positive benefit of the wobble room, is that staff psychology support is no longer something that is walled off behind in a building somewhere separate, that if you go to it everyone knows that you're going to occupational health, and there's in stigma, rightly or wrongly, but that's how many staff feel, is I can't get to the staff wellbeing centre because it's on a different site. I don't want people to see that I'm going. Actually, we met people where they were. You were bringing the staff psychology support into the staff area, and we gave people an opening for that. So that's hugely positive to hear. Thank you.
We also had a comment from Leslie, which she thinks is really important and really compassionate. She just wondered if you had any resistance when you started to implement it.
What's interesting is I shall just come off shared screen, shall I? No, because it wasn't mandatory. So literally, it was just me putting a photo on the thing on the door and getting my colleagues and I to make these wobble room resources. And then I look back 3 days later and Twitter had just gone bonkers. So it just happened organically. And that is the key of a social movement, is that it captures the sentiment of how people are feeling, and then they go and make it their own. There hasn't been any resistance locally for us to making wobble rooms. I know that some places perhaps have struggled to find the right space. But I think the importance of wobble rooms means that most places have realised staff needed somewhere to decompress, is that their usual spaces were taken away. And so repurposing a room like they did, the CPD room that really wasn't used very often because people now often do their training online at home. Actually, great, let's repurpose this room. And it's reclaiming all that land that was given away as there's needed to be over the last 20 years. We're reclaiming that and saying we need to have a junior doctor's mess. We need to have a staff room that is not just somewhere you can sit and eat your lunch, that is somewhere that you can recharge. I know different hospitals will have had different experiences, but hopefully some of the content from today, from the PhD that will come out, and from the blogs will help people go forward and say, actually, wobble rooms are really important. And yes, I can share that YouTube link if you would like that.
That'd be great, thank you. We have just had an anonymous one message as well, just saying that their wobble room got taken away just for the room. They didn't have the room, and it feels a bit broken and flat, and they felt a bit uncared for. And they're just saying, please don't let people take your wobble room away.
Well, I think that's really important. That's almost the next level. Well, it depends whereabouts in the country you are, but as I said, in Bradford, COVID, we are exactly where we were that first week in April now, and we aren't at the second peak yet, and people are needing these spaces again. So it's within the gift of health and wellbeing teams to show how important these are, and even if they're not in every single area that staff wobble rooms exist, or call them wellbeing rooms, or whatever you need to call it, then go for it.
We also have Kay said she found running the wobble rooms at Homerton was quite exhausting and all-encompassing. Yes. But they did find it hugely rewarding, and could see that it made a real difference. So, and it raised their profile. So they're happy. And Benny says, Kay, it was brilliant. Well done.
Yes, well, the Homerton wobble room really was, wobble room on steroids, wasn't it? It was everything and everything and everything. And every time I look back and go, oh, they're doing this now, it's amazing. So you're right, there were some places that really it did become a huge industry in itself, and that was really important for staff. For some staff who were being repurposed and couldn't do their old job but needed to contribute. I talked about that, the Kubler-Ross curve. Many of us just felt we needed to contribute in some way, and you could not all work on the COVID ward. And for some people, this was the big contribution that they were making to their own psychological well-being. This is what I did during the COVID crisis. I couldn't go and work on ITU. I know I couldn't do my usual job because I was shielding or for whatever reason. But this is what I did. This is the contribution I made. And that can't be underestimated either. That it's not just the wobble room supports people. The people who are creating the wobble room are themselves being recharged and inspired by being able to do this, being able to gift this to people. And so that's hugely, hugely important. So yay, the Homerton. But they don't all have to be like that. They can just be a clinic room with chairs in. It's having this, naming a space is so important, that it's okay. This is the space that you can go and have your moment. So I say they did become beautiful because of well done Captain Tom and all his walking and all that charity funds that we got that had to be spent on staff, couldn't be spent on equipment or patients. And suddenly, oh, what do we do? Well, great, we can buy fridges and sofas and screens, but it doesn't have to be like that. It can just be a room which is big enough for two people just to sit.
Lovely, thank you so much. We've got a couple more minutes, so if anyone, I'm just going to give anyone like a chance just for any more questions. Bernice.
I've built you in a coffee break, you see.
Yes, everyone's very appreciative. Bernice said, totally agree. Our team that set up the wobble room involved staff unable to be patient facing. Home workers did posters, and they got donations of tea, coffee, biscuits, and even Easter eggs. Great. It doesn't look like we've got any more questions, so you can go and have that coffee.
So if I put into the chat the link for the YouTube video, and I'll also try and put in the link for the blog. But if you just type wobble room blog into Google, it comes up. The video is unlisted, so but I'll just put that into the chat for people. Lovely. But please do share, and please do get in touch if people need more support, and you know, the resources. Very happy to send all those across. Thank you all very much for listening.
Lovely, thank you so much. And yeah, just if you pop that in the chat, I'll leave the room open for a bit, and if something doesn't work, I'll have the links, so I can pop them in the chat as well.
Thank you.
Right then, thank you, thanks so much.